The medical ward is a ward that you're going to find on most hospitals, and these look after patients that have medical needs. So the types of admissions that you might see are the cardiac patient, that is the simple cardiac patient, the respiratory patient, those with endocrine disorders, and the gastrointestinal disorders as well. They're not sick enough to be in intensive care, but they still need medical treatment. So let's have a look at the types of patients that might be in a medical ward. So consider the cardiac patient, that is someone that's an uncomplicated cardiac person. And this might mean that they've come from a cardiothoracic intensive care unit and they've stepped down through high dependency unit and now they're on medical ward, or they've come in for another reason, but because they're cardiac, we just want to make sure they're okay. They might just get a little bit of angina and just need some care around their cardiac health. Respiratory patients are very, very common on the medical ward, and that might be people with pneumonia, chronic obstructive disorders from smoking, and these guys need a lot of care. The nurses would give oxygen as well as just make sure that they're breathing well, and that would be through taking their blood pressure, pulse, as well as their oxygen saturation. So consider the endocrine patient, that is someone with diabetes. You get a lot of presentations with people with unstable diabetes that needs to be stabilised before they're able to be moved out. These patients can be quite complicated because it's quite rare that you're just going to have diabetes. There'll be other complications as well. Gastrointestinal patients might include people with bowel disorders as well as liver and gallstones. So while people may be on the waiting list to have their gallbladder out, they might get a flare-up, in which case they need to be admitted for antibiotics as well as pain management. I remember a patient that came through with terrible cirrhosis of the liver from drinking a lot of alcohol. And the liver is responsible for things like blood clotting. So it's really important that we monitor these people because potentially they can have severe bleeding. Infectious patients are sometimes managed on the medical ward, and these are people that have things like MRSA or golden staph. So who looks after the patients in a medical ward? It's certainly a big multidisciplinary team and everyone's skills are needed. The medical care comes from many levels of doctors. That might be from the intern right through to the physician who's overseeing the care. For students, it's an excellent place to learn on the medical ward because we see a wide range of patients with a wide range of clinical conditions they can learn from. Allied health staff are key to the medical ward, and that might include people such as physiotherapists, speech pathologists, as well as occupational therapists. So the physiotherapists are used to help with chest physio, to make sure that people with pneumonia are breathing well. The speech pathologists are used for those who maybe have strokes, and they need to ensure that they're swallowing well so that it's not going into their lung when they swallow. And the occupational therapist forms part of the discharge planning team. So anyone that comes to the medical ward, their discharge is planned from the day they get there. So we need to get these people home quickly. So the occupational therapist will look at things like their house and see if they need more rails and also what sort of services they're going to need in the community. So if we don't get people out of the medical ward quickly, they might develop things like deep venous thrombosis, that is clots in the legs, or they could in fact acquire an infection. When people are referred or discharged from the medical ward, they could be referred to a wide range of health professionals. This might include different teams such as the palliative care team. It might include the drug and alcohol team, as well as cardiac rehab services, as well as diabetes education. People that are admitted to a medical ward very rarely have just one thing going on. They generally have a range of comorbidities. And what that means is that they have something with something else. So imagine somebody that's quite elderly that presents with pneumonia. It's pretty rare that they would just have pneumonia, that they might have an underlying cardiac condition. They might also have renal failure, that is their kidneys are starting to fail, and they might have diabetes. So together that's called a comorbidity. So when we're treating someone with pneumonia that has multiple comorbidities, it's really important that you make sure that everything's taken care of. So for example, if you've got a terrible fever with your pneumonia, it's more than likely that your blood sugar level is going to be very unstable. So during that acute phase, it's very important that these people are monitored very closely, and that's what occurs on the medical ward. So let's have a think about the emergency department and the patients that present with multiple comorbidities. In the past, these patients would be stuck in the emergency department for a very long time, and often junior doctors will try to investigate the underlying comorbidities rather than focus on the actual problem that day. So medical assessment units are being trialled, and that's so that you can immediately triage someone straight from triage to the medical assessment unit. These are run by very senior doctors who don't take too much notice of the underlying comorbidities, but look at really what the problem is that day and focus on fixing that. Discharge planning begins in this medical assessment unit, and the aim is to have people discharged within 48 hours.